What's up, and welcome to the unofficial NCLEX podcast. My name is Katie Cleaver, and I'm your host. Today's episode is episode 70. The title of this episode is Understand Communicable Diseases and the Modes of Organism Transmission. We're going to talk airborne, droplet, contact, and enteric precautions, okay? Important to know the difference between these, not just for the NCLEX, but as a practicing nurse. So we're going to go to the most precautious and thorough to the kind of least serious. So the first one is airborne precautions. So if a patient is on airborne precautions, they're going to be in a private room, in an isolation room. It will have negative air pressure, and we have to wear the appropriate personal protective equipment, also known as PPE. Frequently called PPE. It includes gown, gloves, and a mask. Typically an N95 mask, or it's a specific mask because the particles involved in these communicable diseases can penetrate the masks, penetrate surgical masks. So those are not appropriate to use in an airborne precaution patient room. Just a couple examples of airborne diseases: the measles, varicella, and tuberculosis. There are many, many others, but those are just some common heavy hitter ones. Typically, if you're working with a pediatric population, you may see measles and varicella. Probably more commonly, though, you may see tuberculosis in the adult patient. However, those are all possibilities. So that would be an airborne precautions room. The next one would be the droplet precautions. They would be in an isolation room. Surgical masks are okay because the molecules are big enough where they won't penetrate through a surgical mask, which is nice because surgical masks are a little easier to wear for an extended period of time than that more in-depth mask for the airborne precautions. So you'll wear a surgical mask, a gown and gloves. Examples of droplets of organisms or diseases that you need to utilize droplet precautions: meningitis, pertussis, pneumonia, and influenza. There are many, many more again, but those are just some very common ones. The next one is contact precautions. Without a doubt, you are going to see contact precautions. You know, honestly, as a nurse, I honestly can't remember the last time I took care of a droplet precautions patient. I know I have, but it's been a while. Contact precautions, it's like once a week. So a patient on contact precautions means that they're in an isolation room, although they can share their room with someone else with a similar organism. You wear gowns and gloves, and wash your hands like any other patient. Wash your hands before and after. So this can be someone with an active infection or with a colonized organism. We want to prevent the spread of this organism. Typically it's MRSA or VRE. Those are the big ones. I typically see patients with MRSA and VRE, and we have to wear our protective gear there. The last one is enteric precautions, which is identical to contact precautions, except the nurse needs to use soap and water and cannot use hand sanitizer. And this is for the patient with C. diff. So that completes this episode 70 of Understanding Communicable Diseases and the Modes of Organism Transmission. Thanks, guys.
This has been another episode of the unofficial NCLEX Prep podcast. To get the massive PDF guide that goes along with this podcast, head over to nrsng.com/NCLEXprep. That's nrsng.com/NCLEXprep. That's a free download that you can take with you anywhere, and you can basically have this podcast in text format. Our goal here at nrsng.com is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. We want you to succeed, and we want you to become part of this movement of nurses that is dedicated and motivated to learning and becoming the best nurse that they can possibly be. My name is John Haas, RN CCRN, and I'm the founder of nrsng.com, and I sincerely thank you for being here, and I'm so proud of you for taking this step in your journey. Now you know what time it is now. It's time to go out and be your best self today. Happy nursing.